Hey, 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 welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, March 23rd, 2026, 2-6. Last week and today, I'm redropping the podcast I did with Dr. Marla Baum in 2021. As I said last week in my intro, Marla is an elite child psychologist and friend. Last week, we discussed IQs and neuropsychological testing, and today, we're going to be discussing the controversy over learning disabilities and extended time. Since I threw redrops at you the past 2 weeks, the next 3 are going to be hot off the press. One on integrative medicine, a mailbag podcast, and one on hyperemesis. All right, thanks for listening. See y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, we're back with Dr. Marla Baum, who is a child neuropsychologist who was just recently on our podcast talking about her past and how she came to become a psychologist and a child psychologist and what neuropsychological testing is and why parents would do it. And we had a really interesting conversation about that. And I said, Marla, we're doing it again. Welcome back.
My pleasure. My pleasure.
Excellent. So I wanted to jump right in to where we were before. And the first thing I just wanted to ask you is, all right, so I'm a parent. I'm listening to this. I've got a couple of kids at home. No one's ever mentioned to me anything about neuropsychological testing. My kid seems to be doing okay in school. I don't know. She could be doing better in this or whatever. How would I know if I need to bring my child to you? Is it something that I should be looking for or only just wait if the school mentions something? Who would need to come for this testing if no one told them about it?
That's a great question. If you don't get direct guidance from someone at school or one of the doctors that you take your kids to, if you don't get direct guidance, but you just have a sense that something's off or wrong or something's quote unquote not clicking, that could often mean that there's something that the child very well may be compensating for up to a certain point. What I tend to find is that a lot of times those kids do hit some sort of wall at some point where it really impacts them. So, you can look at your child's report cards. You can see if there are real peaks and valleys in how they do. Like, for example, if they always do really great in reading, but their math scores are not where at the same level that they should be at, because, theoretically, a child is supposed to achieve sort of generally the same across domains. So if you see real peaks and valleys in your child's report cards or how they do on statewide standardized tests that they give in the public schools or the ERB tests that they give in the private schools, those are really good possible indications. I mean, those are really good sources that you can look at to see if there maybe is something going on. But, a lot of times parents come in and they just say something's not clicking and they can't articulate it and they're not sure what it is, but they have what I call mommy sense, which is something I learned from another colleague. It's a great term because parents, they usually know their kids really well. And if they see that something's not clicking, that can often mean that there's something going on. And it would at least warrant a conversation to see if there's something we need to pursue. The other main thing that parents should look out for is if the child is very distressed about school. There are a lot of kids out there that will do fine in school, but then they come home and they're weepy or they're anxious or, they're just irritable, not regulating themselves well. Sometimes that could signal that maybe something is going on for them during their day that's hard for them. And, these kids have to go to school and do all the work, whether they're good at it or not. You don't get to self-select what you want to study until college. So you could be, not a strong math student, but yet you still have to push through and you have to go every day and face it and do the work. And if that's stressful, that could lead to some, possible anxiety or things like that. So I would look for that also. And then the last thing I would say is if teachers say, they're really distractible, they're really not paying attention, that to me is a real flag that there's something going on. It might not be an attentional issue. The kid can be going through a lot of different things and it would look like an attention issue. There's often times where you come in with a possible attention issue and it's something else entirely. And the child was just trying to deflect the attention off themselves in the classroom by being goofy or impulsive. So, those types of things that just don't seem right, quote unquote, could often really be an indicator that something's going on.
Right. Now, if the school has a school psychologist, that would be the first person to turn to, correct?
Yes.
Excellent. And if the school does not have a school psychologist and parents feel like there isn't a person in the school who is either capable or willing to, or whoever has the time to discuss this, then maybe they would seek out someone like you directly.
Yes. Or, a lot of pediatricians, especially in New York, pediatricians, they all have lists of psychologists that they refer to. And the pediatricians are usually really good at teasing out, if this is something real that, might warrant some further evaluation and intervention. So if you don't have someone in the school, either the school psychologist or sometimes the schools will have clinical social workers on staff or the head of the learning support services at the school. Those are usually good places to start. But, I think the listeners should just know that if your child is in public school, my understanding is that they are really not supposed to recommend something like a neuropsychological evaluation for different political reasons. But besides that, people in private schools and outside the New York City public schools, I think the schools are much more able to, refer for a neuropsychological evaluation. So if your child's in public school in New York City, I would start with the child study team, whoever is there that's in charge of services for the children in the school.
Got it. And then I was curious what your thoughts were. Let's take cost out of the equation. Let's say this were free. Is there any reason why every child shouldn't have neuropsychological testing? Like, is there a downside to it potentially? Or is it something that it'd be great if every kid got it, but who has the time, who has the money type of thing?
Right. So the thing is that these evaluations are very comprehensive and they peel apart every skill that the child needs in order to be able to learn. So if you test every child, you are going to see some variability. At some point, there will be something that will be challenging for that. Now, if there was no reason for referral, so to speak, there was no presenting problem, it could be good information to have. But, it's sort of like those cancer screenings. Like if you're healthy, do you go find the information or do you, live until you have a symptom and then you see what's going on? It's the same sort of thing. I've had some parents come in that they just want a good study on who their child is as a learner. And that's completely fine. But if your child's not outwardly having any sort of issue, I don't think it's something you necessarily have to put them through. I mean, the kids will find it mostly very reinforcing. It's, it just ends up being a lot of time out of school. For some people, it's cost prohibitive. So I wouldn't recommend it unless there's, a specific issue.
Okay. I guess that makes sense. And what you said before is actually going to lead to my next series of questions. And I think this is such an interesting topic. And, all of us who are parents now and are living in the world today, we all know that there is a truth that compared to when we were kids, there are so many more kids with diagnoses right now than when we were growing up. No one had anything, right? You were either allergic to peanuts or you weren't, and that was it, right?
Right.
And now everyone's got something. And so my question is, people look at that differently. Some people say it's great. Some people lament that. Everyone's got their own view. But do you think it's a function of more testing, or have kids actually changed, or has the school or the world changed that's sort of bringing these out? Why do you think that is? I'm curious because you're in the middle of it. So what do you think?
Yeah. So my perspective is when you and I were growing up, I myself got flagged for, some reading comprehension issues. And I remember going to this room in the back of the cafeteria at our school, maybe, and sitting with one of the learning specialists and doing some work on reading comprehension strategies.
Yeah,
And that was
I had the same thing, but it was all behavior. They're like, this kid can read great, but he's a pain in the ass. And so we got to deal with this behavior. I actually had to go to speech therapy. You know why? Because I talk too much. I needed therapy to tell me to shut up. So when I said, you know what? I'm going to grow up and I'm going to get a podcast. I'm going to turn this into a strength.
There you go. There you go, Nady. See, it's always about just finding your strengths and using them.
No joke. I talk too much and they sent me to speech therapy. Genius.
I think what ended up happening is that there is this piece of legislation called the IDEA Act, the IDEA Act. The IDEA Act basically put into law that schools are required to support children with disabilities, whether they're learning disabilities or medical or physical disabilities. So I think what came out of that is this push to have to document which kids need help and which ones don't, which then, got the psychologists involved because we are the ones who have, we have authority over the domain of testing. So, we have all of these standardized measures. Many of them have been around since the 50s. And of course, they get renormed and updated by law, by our ethical code. They have to get updated every 10 years. And, so we had to start to assess kids in order to identify what these learning issues were and, what qualifies as a learning disability in terms of a statistical analysis or a clinical interpretation of the data. And then schools became responsible for providing the services. And then over time, it's evolved. And I definitely think, people are more apt to test their kids now and identify what the issues are. But I also find that kids end up feeling more empowered in school because they're actually getting the help that they need. I know plenty of kids, as I think some of them were your friends, maybe, in our high school, and definitely some of my friends that, they definitely had attentional deficits. But when we were growing up, there was nothing to really do about it.
Punish them. Right.
That really engendered a real sense of shame about these learning issues. And, I'll be sitting in my office with parents and they'll say, yeah, but I got through it. And I'll say, well, how did you feel about yourself when you were going through school? And they would say, I felt very badly about myself. I didn't really feel very effective. So I think that a lot of what we're doing here is really just helping kids realize that there are different ways to learn. And, certain schools are better than others, are more able than others to differentiate and individualize for a child how they learn. And, it's really just to protect the kids' self-concept.
So you're saying that basically if we went back in time to when you and I were in elementary school, and we tested the same number of kids, we would probably have the same number of diagnoses as we have today.
Yes, like when it comes to the autism community, a lot of people say, well, are there really more kids with autism or are we testing more? My theory is that there's a combination of multiple factors.
It could be both.
Yeah, I think it's both. When you go looking for things, you find things.
Right.
It's the general rule of thumb in a lot of what we do. But the idea is whatever you find, is it impinging on the child's functioning to a marked degree where you want to intervene so that they don't become unduly stressed or they don't lose their self-esteem as a learner, as a student. So, we're testing more, but, my personal opinion is that the kids are better for it.
Right.
Because they get a sense of who they are as a learner and what their strengths are and what their weaknesses are. And they use those strengths to compensate.
Maybe some of the discomfort people have with it nowadays, or for those who do have discomfort, is the idea that what you're describing is just sort of variation in how people learn, and everyone has strengths and everyone has weaknesses, and it's sort of identifying it. But like you said, it sort of has to get labeled as a disability. And that calling, someone who's weak in a certain aspect of reading, let's say, to now like label that as disabled, I think some people get uneasy with that concept
Right.
When we were kids, you weren't disabled, you just, something was harder for you. And some of it is semantics, obviously, but I think that, and it's understandable you're saying, because you need to have that label in order to qualify for services. And there's like reasons to have that label. But I think that maybe some of the language that's used is why there's a disconnect maybe between the people who think it's a good thing versus people who think it's a bad thing.
That's interesting. So, yeah, I have a couple of comments on that. So, yeah, there's definitely a lot of people our age, a lot of parents out there that think that there's a real stigma to being labeled. Now, in my experience, the only reason I use diagnoses per se is for insurance purposes and applications to special schools, because they need to sort of know on a broad level what types of applicants they're getting. Otherwise, it's more about what are the child's strengths, what are the child's weaknesses, what is getting in their way of achieving, and how can we overcome it. The labels themselves, I agree with you, they're mostly semantic. And a lot of parents are worried about the label per se, but when they see their child get the support that they need, stress about the stigma starts to melt away, because the child is happier and they're achieving and they feel productive and they feel effective when they're going to school every day.
Yeah, I don't see the kids as finding the stigma. I mean, I look at, my kids, our kids are all varying ages, and them and all their friends, they're all very open about this. No, it's not a stigma
Yeah,
for the kids. It's only stigma for the
exactly.
parents, right?
Exactly.
We're the ones who need the remediation, because we're all the crazy ones. I mean, all the kids are very open, and
Yeah.
they're very,
Yeah.
I don't want to say happy, but I think that they do feel some sort of validation that, yeah, there's a reason I'm struggling. This is the reason I'm working on it. And they're quite open with each other typically about all of these.
Yes. And, it's funny because every now and then there will be a parent in my office that, even if they have their own mixed feelings about what's going on with their child, they can usually put that aside and still do what they need to do for their kid. And if they have their own feelings about it, we can address that. Sometimes I'll talk to the parents 2 or 3 times after the testing is done, because they just need some help sort of coming to accept this, right? I really worry about the parents that can't put their own feelings about it aside and just do what they need to do for their kid, and because of their own block, because there's something that they're worried about in terms of the stigma. So, but again, it doesn't happen that often, but unfortunately I have seen it happen, and it's sad for me to see the parents that are open about their feelings about the stigma and whatever the implications are of the results of the testing. As long as they're open about it and they can put it aside in order to give their kid what they need, that's the best way for parents to cope with it.
Right. And I
With this
think, yeah.
process.
And I think one of the interesting things, and this is something that I learned from my wife, Michal, and her in her professional sort of experience, is that a lot of this sometimes is also just a function of the environment. And what I mean by that is, you can have a child who has, an average or high average, or, a totally normal IQ and testing and this, but it's only difficult when they're put in a very competitive
Right.
and challenging school system, right?
Right.
Sometimes you go to school and they expect, whether it's a dual curriculum or longer hours, or they really push the kids. And so for that child in that school, it's going to seem like he or she has, quote unquote, a disability. But if they go to a different school where they're sort of learning at the same level, they're going to achieve and, feel great about themselves. And so,
Exactly.
and that's a choice that parents have to make. What school do they
Yes.
want their child in?
Yes. I've had that conversation with multiple families over the years, that there's actually nothing wrong with your child. They're just being asked to achieve 2 and 3 grade levels above what developmentally they're supposed to be doing. So some colleagues of mine have coined the term a curriculum disability, that there's not that there's anything wrong with the child, it's just the school is pushing them to achieve 2 and 3 years ahead of what their brains are supposed to be doing, and therefore there's a problem.
Right. It's like if someone doesn't get through Navy SEAL training, it doesn't mean they're out of shape. It just means they can't get
Right.
through Navy SEAL training. Like that's, most
Exactly.
normal people can't.
Exactly.
I also wanted to touch on, and it's in the same conversation, obviously, is extra time, right? And I know this comes up all the time. And
Yeah.
the idea that certain children, based on either testing with someone like you or for whatever reason, qualify to get extra time when they take tests in school or on standardized tests or for projects or other
Yeah.
what we call accommodations. And can you just sort of explain, how does that work? Who gets those? Who qualifies for those? Why would someone qualify versus not qualify? And then we'll talk about sort of all of the meta conversation about this afterwards.
This is a controversial topic, a really hot topic.
Again, Marla, that's why we're here, man. This podcast, we're doing it.
The thing is about extended time. Some kids are deserving of extended time because of learning issues that they have. Some kids are deserving of extended time because of emotional issues that they have. I think the biggest issue that has really muddied the waters in this field, in this particular issue with extended time, is that, and it's really the Board of Ed, whether in New York or New Jersey. I've seen it constantly in New Jersey also, that no matter what a child is presenting with in elementary school that might necessitate an evaluation and some services, they always get extended time as just part of the package from the Board of Education. So what ends up happening is that all of these kids that maybe don't need it are granted it. Kids with ADHD, so to speak, for example, they, the Board of Ed, like in Bergen County, for example, where I also have an office and where I live, the Board of Ed automatically gives extended time to any kid that presents with a problem. And a lot of times the kids don't need extended time, and that's not what's going on. And that's not what's going to help them. But they are now slated as deserving of it. And so that ends up being a problem when a kid comes along with a real learning disability and also needs it. And it breeds a lot of tension and competition amongst the parents. Well, why does your kid have extended time? Why does my kid not? Could my kid benefit from it? The idea about extended time is that you can give kids all the time in the world. And if they don't do any better on whatever the task is, even with extra time, then they're not deserving of extended time. That's my clinical opinion. Unfortunately, this issue has gotten really murky and yucky because the Board of Education is just giving it to every kid that has any sort of issue. In my opinion, if your child does okay on a time test, but with extended time does better, that to me is something to potentially pursue, because with extended time, they were able to do better. Whereas, like, let's take the SAT. Let's take the reading comprehension portion of the SAT. If you're a bright child, but you can't finish within the time, and with extra time you finish and you're able to show what you can do, then I think that makes you a candidate for extended time. Whereas you might have someone that finishes and they might not benefit from getting extended time. Those kids should not be getting extended time.
But why would they want extended time? I mean, why would it be an issue if they're granted extended time if it doesn't help them?
Well, that's exactly the issue for me. If extended time doesn't help a child, then that's not what the child's issue is, and they shouldn't be getting it.
This is a really, I mean, as you said, it's a hot topic. I always tell my kids, like, based on the number of kids have extra time, I think it'd be easier to just give everybody more time and take the few kids who are really high achievers and give them less time.
Right.
Say, you qualify for less time. You're
right.
You get to finish quickly. But
exactly. Like, what is this issue of time?
Right. Well,
why do
we care so much? I think I think that there's two sort of separate issues. And I think one issue is sort of the ethics of it and sort of the idea of who has access to this. And maybe some kids get it because their parents paid for testing, and another kid got it because their parents are a little more savvy about it, or another kid got it because they went to a psychologist who's more lenient about, recommending it. And so there is this sort of idea of like justice, like maybe that there's an unfair distribution of which kids get it and which kids don't get it. And that's its own conversation. And I think it's a problem, but that's its own conversation. But I think there's a second conversation about, even if it were completely fair, so to speak, like all those problems were, solved, just the idea of why do we care how much time it takes? Like for
Exactly.
most tasks that we have to do in life, you're not timed. And so it seems to me like, why wouldn't all tests be untimed unless you're being tested for something that needs to be done quickly? So, for example, like if I were to do like an aptitude test for doctors, doing something quickly would really only matter if they're going to become like a trauma surgeon or an emergency room
Exactly.
physician. Whereas if they're going to become a
Exactly.
radiologist or pathologist, who cares if it takes more time? Like, why? Like, what's the difference? Or,
Right.
someone's going to law school. If you're a trial attorney, you probably have to think on your feet quicker than if you're a tax attorney. And so
Right.
for the first, you definitely need to know who can do it quickly. And for the latter, you don't care. And so I think that, tests have been timed, I think, for logistical purposes. You need to have some sort of time limit. Otherwise kids will sit there all day. But
Right.
but the fact that like exactly, who cares? Just let everyone have extra time.
I agree with you completely. The only profession that you really need to be fast are exactly what you said: trauma doctors, air traffic controllers,
Right. You don't want anyone
pilots.
with extra time in that job.
Right. You don't want a full processor who's controlling the air traffic over JFK. So this issue of time has come up because we have these standardized tests. And, so what happens is that kids with dyslexia can't read quickly. So they're at an actual disadvantage because they can't finish because of their dyslexia. And then if they can't finish and they don't score as well, that can have implications for where they get into high school, where they get into college, and whatnot. So this whole thing was born out of a really, really legitimate issue, which is that kids with learning disabilities and sometimes with language processing issues are really at a disadvantage in these situations because they don't work quickly. They need more time.
But they're not at a disadvantage sort of for other things. I mean that the test that they're using as the gatekeeper is the
Correct.
disadvantage. But they can do just as well when they get into college because they have time to do stuff.
Yes.
And
But I do also find that these kids, they do need some help in terms of figuring out where to spend their time, what to focus on, where to cut corners. Like there are some things that they need to know for their life. If they're going to be a trial attorney, they're going to need a lot of help with time management so
right.
that they're not up all night writing their, the briefs and whatever. So the issue, it's gotten very muddy because, almost any medical doctor can write a letter saying, please give the child extended time because of A or B or C. And because of the Individual Disability Educational Act, the IDEA Act, if there is a documented disability,
They have to grant it.
they have to grant it.
Yeah.
They have to grant it. And sometimes it's very legitimate. It can be, a child that has like a traumatic brain injury and all of a sudden needs extended time because they're going to get headaches and have other sort of symptoms if they're pushed too hard. Those situations all, they all make sense. But I agree with you. There are very few things that we actually need to do quickly in this world.
Right. I have a friend who works for the college board, and the college board oversees, SATs and, AP tests. And I asked him this question. I said, like, what's the deal? And he said, for us, we'd be perfectly fine making the SAT unlimited time. He said, we don't really care how much time people have. He said, it's
Yeah,
purely logistical. He said, because if, you're talking about, a million plus people are taking this test. And if the test is all day, you need to have twice as much time proctored, right? So that
yeah,
costs money, and you're going to have to probably provide lunch for kids. And he said,
right.
it's a big deal to double the time of the test or triple the
Yeah,
time of the test. It may have to be over several days. And he goes, it's a tremendous cost. And he said, and that's right now the main reason they don't, which is why they're very, I wouldn't say lax, but they don't fight too much the extra time because it's not like they care from an educational perspective. It's just,
right.
it has to be, and it's interesting. I think a lot of people recognize this, but like in school, how would you do that? How would you say, okay, you have a math test, take as much time as you want? Well, I got chemistry
Right.
in 45 minutes. I need to finish. And I think that there's a lot of logistics that have to be worked out in order to do that. And maybe we just have to change how we assess kids. I don't know.
Maybe. I've also told many parents that, they come in thinking the child needs extended time. And I'll say, based on the results, that's not what's going to help your child. What's actually going to help your child in their life is to actually learn how to take a test in a more organized way.
Right.
There's other strategies besides extended time. Everyone just thinks, oh, you have all the time in the world, you can do it. It's not the case
Right.
for a lot of kids. You can have all the time in the world, but if you don't know how to take a test, you're not going to do well no matter what.
Right.
So it's not this panacea that everyone thinks it is.
Good word. I like that.
Oh, thank you. Yeah, it's not a panacea. It doesn't solve all the problems. And if you ask me, it can actually train kids to not be efficient.
Right.
It is important to be efficient in this world, no matter what we do. You have to be able to do things quickly enough, because we don't always have the luxury of all the time in the world. It's a little bit different than what we were just saying, but it's not necessarily always going to be so great for the kid to have the extended time.
Right. I mean, it's obviously somewhere in the middle of those two. You can't take forever to do things, but you shouldn't always be pressured for time. It's sort of that
Exactly.
balance. Do you find in your clinical, work and in your experience, do you find a lot of parents who are trying to game the system, or do you think that just this is the system and that's how the chips fall?
I have definitely encountered parents that try to game the system. I have encountered parents where I recommend that they don't need it, but yet the school grants it 2 weeks later, and I don't know why. There are definitely parents that try to game the system, and they're not helping. They're not helping the situation. I can't blame them because parents want to do whatever they can do to support their child's success. So the intentions are usually good, but it doesn't actually help their child. I'm thinking of one case in particular. He didn't need it. He didn't need it. I told him he didn't need it. It wasn't recommended in the report, but I don't know what they said to the school or whatnot. And the kid got it. And I think the kid's going to be worse off for it because he's not actually learning anything about, how to be more effective, how to be more efficient. So I definitely think parents game the system, especially in New York City. I think there's a lot of competition. Manhattan is a very unique place in terms of education for children. And, there's a lot of competition and there's a lot of wealth, and that can lead to some real, discrepancies or lack of accessibility, like what you were saying before. I'm sure there are parents that have written checks to schools in order to get their kids what they want for them. It happens. Most of the time it's legitimate, and most of the times the parents, they really just want to know what is it that's going on. And it's not, if they get extended time or not, as long as they know what's going on and what the child needs, then it usually works out fine.
I just think it's so fascinating, and because so many people talk about this, and like I said before, I think it's fascinating because on the one hand, there's the issue of whether it's being done fairly, for lack of a better term, and that's a huge issue, and people talk about that and argue about that. But again, I just think on a higher level, there's this idea we're talking about of whether it's even appropriate to have this metric on tests
Well, right,
of finishing it in a certain amount of time. And maybe
right.
in some instances it is the right thing to do, and in some instances it's not the right thing to do. And I think that, we've been, the way my kids take tests is the same way we took tests. And you got to
Right,
think we've learned something since we were kids, right? And
right,
maybe that has to change in how we
right,
view
right.
evaluations and assessments and testing in general. And even if you want to change on the third level, how do you do it? Like practically, it's
Well,
very
right.
hard.
Like, I'll give you one example of to compare two different situations. So child number one has a significant dyslexia, very, very difficult to decode, very disfluent when they can decode. That type of child, I feel very strongly, should get extra time because they would be at an undue disadvantage because they just can't get through the test fast enough. Versus child number two, who has an anxiety disorder, who is so obsessive about every question that they're doing, and that's what's causing them to run out of time. I do not think that type of child should get extended time because all that's going to do is give the child the chance to ruminate and obsess more. And from an anxiety disorder standpoint, that's the exact opposite of what you want to do for the child. So that child, I would not recommend extended time. I would recommend therapy to learn how to contain their anxiety so they don't get into an obsessive loop in the middle of a test. Then there are some clinicians and some schools that feel, and that's like a cultural thing. Some schools feel they don't want the kid under such distress, and they would rather give them the extended time so that they stay calm and they don't have a panic attack. But I think there's room to work with the school in that instance and, come up with a way to assess the child while you're trying to, teach them how to not ruminate and obsess over each test question and eat up all their time. So, that's just one example of how it can be really appropriate versus really not appropriate. But, sometimes it's about the school personnel and what they think. And sometimes it's literally about the numbers. And if the school already has, too many kids for their quota getting extended time, then maybe they would have to say no. There's so many factors involved. And I agree with you. It really might be this sort of self-induced, sort of thing, because for most things in life, you can have more time. There are very few jobs where you just have to be so fast. So why are we valuing speed so much? You can be the fastest person in the world, but if you can't learn, then what's the point that you can do it quickly?
Right. It would seem to me that the ideal sort of if you're going to do a standardized test, and there's reasons to say not to do them, but let's say you're going to do them, is to sort of have let's say 4 sections, one is reading, one is math, one is, let's say, whatever, logic or something, and the fourth one is speed. And so you get assessed on all 4. And okay. And so kids know, there's certain things I do well, and, because I'm not timed, and there's other things, in terms of speed where I don't function. Other kids function very well in speed, but maybe not with the others. And it just seems like it's another measure of, how they're going to perform. And when they get shuffled together, we spend all this time trying to separate them apart because we put them together to begin with.
Mm-hmm. Mm-hmm. That's right. Now, actually, on the IQ test, it is separate. Those are 2 of the 5 factors. One of them is processing speed. Another one is, your actual abilities in the verbal domain. And yeah, they're different cognitive functions. So if you ask me, we shouldn't be worrying about speed so much unless it's from an efficiency standpoint, like a logistical issue, like what your friend at the College Board was saying.
Right.
Only if the child, I, for example, I am a slow processor. I'm a slow reader. You just can't, I knew that I couldn't go into a profession that I have to read very quickly. I would not be able to do that. If you don't have good spatial skills, you shouldn't be an architect. If you don't have good hand-eye coordination, you're going to have trouble being an athlete. To me, it's more about learning who you are and what you can do. And this time issue has really, all it's really done is engender a lot of stress and a lot of tension. And it should really, in my opinion, be reserved for those kids with significant learning challenges that it's just not fair to ask them to read as quickly as the kid that doesn't have an issue reading quickly. Because what are you measuring? Are you measuring speed or are you measuring ability? I think that goes back to what you're saying. What are these tests really about? Do you have to be fast in order to have an ability?
Marla, that's awesome. You're the best. I'm so glad to know you.
Oh, this feeling is incredibly mutual.
Wonderful.
For sure.
Well, thank you so much for coming on and spending all this time talking to me.
You're welcome. Thank you for inviting me.
Wonderful. So, Marla, you are a psychologist. You practice on the Upper West Side and in Cresskill, New Jersey. And you have a website, which is www.drmarlabaum.com. That's DRMARLABAUM.com. And obviously, if anyone's local and wants to see you, they can find you through your website. And I obviously look forward to seeing you around town.
Oh, wonderful. Thanks for having me, Nady.
Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.